Many people often ask me, why did you join the military at such a late stage in your early 30s? The truth is, around 2014, my spouse and I found ourselves navigating the complexities of Obamacare. We all remember that period. Enroll in Obamacare or face annual fines. I believed we needed a low deductible to avoid any financial surprises. However, living in New York City, we earned just $1,000 over the threshold for subsidies under the Affordable Care Act. Consequently, we were stuck paying about $1,300 a month for health insurance on top of our other living expenses. It was overwhelming. So, when the military announced an increase in the enlistment age, I jumped at the opportunity. Military health insurance was significantly cheaper, and this government-run healthcare didn't challenge us as much when it came to covering medical costs. Thus, I enlisted in my early 30s, largely due to the burdensome healthcare expenses. Fast forward to roughly 2 years ago. My mother suffered several strokes, leaving her paralyzed on the left side of her body. She qualified for Medicare, which seemed promising until she was discharged from the hospital. The problem? Medicare didn't cover the long-term physical therapy she desperately needed. Thankfully, my sister discovered a charitable service that provided her with weekly therapy sessions, but honestly, that was barely enough. My family couldn't afford the extensive treatments she required. After her discharge, the limitations on her therapy coverage became painfully clear. Yes, we are grateful for the weekly sessions, but she needed therapy several times a week, which was financially unfeasible. Unfortunately, due to the lack of adequate care, my mother's paralysis has become permanent. Perhaps if we had been more informed, we might have invested in supplemental insurance for her in her 40s. But for many working middle-class individuals barely making ends meet, such knowledge feels out of reach. My mother, now in her 70s, dedicated her life to caring for me and my siblings, only to face the harsh reality of immobility. While I won't claim she made the best choices regarding diet and exercise, who knows what her life could have been like had she received the physical therapy she required post-hospitalization. To add to our challenges, my father was recently diagnosed with dementia, introducing yet another layer of concern for our family. Fortunately, we aren't at the crisis point yet, but it's unsettling to contemplate his future. Although he is generally okay now, a dementia diagnosis casts a long shadow. We've all heard the distressing stories of families struggling with dementia. I'm currently exploring several business ideas to generate supplemental income, as I refuse to be naive about the difficulties ahead with a paralyzed mother and a father facing dementia. My family understands that insurance will not cover the essential support they will need to live comfortably in their later years. No, my family doesn't have United Healthcare. In light of recent events, I felt compelled to share this personal narrative in response to the troubling reactions surrounding the CEO's demise. While I do not condone violence is unequivocally wrong, I find myself grappling with how to feel about the late CEO. I struggle to muster compassion in a moment when insurance companies seem so routinely devoid of it. They are, in my view, a significant factor in making my parents' twilight years painful for both them and us. I genuinely don't know what else to express on this matter. I recently came across a quote that resonated with me. I've never wished a man dead, but I've read some obituaries with great pleasure. Mark Twain. This comment was shared in a discussion about the former United CEO. What does this have to do with politics? Well, most individuals who meet a similar fate, yet aren't CEOs of major corporations, rarely receive media attention. I find the public's reaction fascinating. I doubt this incident will lead to significant change, as the health insurance industry is often perceived as lacking empathy. I have a feeling that politicians are closely observing the public's casual acceptance and tacit approval of such actions. I guess only time will tell.